Hello, lovely podcast people. I hope you are well. Welcome to another creatine episode. I really hope you're not getting bored of these. I was thinking today, actually, that I think I've got this little Word document, 5A and 5B, these next two, and then 6. So really 2 episodes time will be really just a nice summary of creatine, what it does, how exactly to use it for you in your situation, so that any of you who kind of signpost clients to the podcast or, those kind of things can, just use that one rather than people having to listen to so many episodes. But I think really my listenership is people who like to know lots and lots. So I hope kind of this deep dive into creatine has been helpful. There's also other people actually saying that out loud when I was saying sharing it with clients. Some people, I've seen a few things just cropping up on social media. The weird thing is that people are using like hashtags like Mac Nutrition Uni and Mac Nutrition, but they're not even Mac Nutrition Uni students. But they're just taking stuff from my podcast and just doing posts on it, but not crediting me. It's literally like some of the sayings that I've said in podcasts. It's just a bit weird. You have to kind of check your ego sometimes. It irks me a bit when I see something. I'm like, it would just be nice. I know you've listened to the podcast. You've literally used my phrase there. Anyway, it's out there helping people, and that's what I have to remember. But it does get on your nerves sometimes. Anyway, where are we? Thanks to everyone who shares the podcast round, posts it when they're listening, gives credit. It's very much appreciated. You are appreciated. Anyway. So this episode, this one and the next one, I've chopped it into 2 based on loads of the questions that you guys sent. People posting in my story box, posting on the suggestion form, a few questions that have come in on the posts that I've done so far about creatine. And time again, I've got 1, 2, 3, 4, 5, 6, 7 questions just written down here, all relating to, I guess, around the concept of water. Creatine and water, creatine and water retention, creatine and dehydration, creatine and the effects on the kidneys. All of these things I felt like came under one bracket, and that's what I'm going to discuss briefly, quickly, a nice summation in this podcast, so that again, if people are interested or have discussions around this, it's a nice reference point for people to point people towards. So I think I've probably mentioned this before, but creatine increases the amount of water in your body. So time and time again in different studies that measure it, because studies don't always measure it. They might measure the levels of creatine in muscle, for instance, but they don't actually measure the changes in body water. Sometimes that's not part of their research question. But in the studies that do look at that, you will just see one of the compartments of water in the body go up. So there are different compartments of water. Your blood plasma is hugely made up of water. The greatest percentage of it is water. And then your muscles are water. Your fat cells have some water in them, but your adipose tissue has a water component, but it's small. You have subcutaneous water. You have intracellular water that's inside your cells. You have extracellular water that's outside of your cells. So there's lots of different compartments of water in the body. And the main one and this is this question, where is it? Do you retain water? Why does creatine make me look watery, puffy? And really my blunt answer to that is it doesn't. It doesn't do that. Something else is doing that. And I think I mentioned before about the old school Holland H&B creatine that had like 80 grams of sugar per serving. And so obviously people's calories were massively increasing in something that isn't overly good at reducing appetite. So people still keep eating all their other food at the same time. So maybe people were gaining body fat. And that's why people believe maybe creatine was making them look puffy. And also because the effect of the placebo is strong. Someone tells you, or you read on the internet, creatine increases water retention. And people hear, where do we most commonly hear water retention? I imagine, my guess, my assumption is that the largest place people ever hear about water retention is menstrual cycle related water retention, and people complaining about that, their mum, their girlfriend, their sister, their friend, whatever, or noticing it in yourself. That's what people think about when they think about water retention. But that's not. So for instance, drinking sports drinks increases the retention of water by the body because it contains electrolytes, and that helps the body retain water. So it's retention, water retention. But it's not causing this puffiness, this bloatedness. It's making my skin look different. That's not what creatine's doing. So in the studies, we see that the main compartment that creatine increases is intracellular water content, so the water inside your cells. So really the place that when bodybuilders want to look really lean, that's where they want the water to go, inside their cells, inside their muscle cells, which is what creatine is doing to quite a large extent. So, do you retain water? Yes, intracellularly. So, and they have studied the intracellular and extracellular water components. And there was a study in the last roughly 5 years that looked exactly at this. They measured intracellular, extracellular, total body water. And they showed, and muscle mass as well. And they showed that muscle mass went up, intracellular water went up, but the extracellular water stayed exactly the same. And actually the ratio in people who were taking creatine, because it was a placebo-controlled study, so in the placebo group this didn't happen, but in the creatine group the ratio between muscle mass and extracellular water, where maybe we wouldn't want it, maybe we could claim that it was making us watery or puffy or whatever the words people use are, didn't happen. It actually tended towards decreasing that ratio. So muscle mass was going up and extracellular water stayed exactly the same in both the creatine and the placebo group. So I hope that kind of provides a little bit of, for people who are worried about taking creatine and it making them look different, a little bit of reassurance on that front. There doesn't seem to be a great deal of difference between males and females, that, for all intent and purposes, that I can see. There is a inter-individual variation. So T-E-R, between individuals variation. So some people don't seem to gain as much water with creatine as others. This concept of responders and non-responders, that kind of thing. But to some extent or another, people tend to gain some water weight. I did have a question. I don't know if I wrote it down here. Yes. Does water retention last the entire course of supplementing? Yes, and because that's kind of the point of creatine. It's almost, you could call it its method of action. It's not how it's causing lots of the benefits that it has, but it's part and parcel. Sorry, I've got dry lips. Part and parcel of what creatine does. It's kind of a bit like if you went, put petrol in a car and you're like, my car's getting heavier. It's probably a good analogy if you think about F1 cars. They do have this weighing up of providing enough fuel, but also it changes the weight of the car, and therefore the car doesn't necessarily go as fast, but then they have less stops. And it's a similar thing if you think about athletes. When I talked about in last episode, I suppose I didn't really ever. Did I touch on it too much? I'm not sure I did. But on hurdlers, I think I did in one episode. But obviously, if you take creatine and it makes you heavier, and then your stride pattern's a bit different or whatever, your biomechanics changes. But anyway, for those of you, it's not making you look puffy, and you shouldn't really have your worth based on what weight it says on the scale. So if it goes up 1 kilogram, it's absolutely irrelevant to how you look, your worth, your whatever. There is something to be said for if you gain muscle, and this is something that lots of you as practitioners do need to consider, and I feel like I've mentioned in other podcasts around this area, is sometimes people want to be able to fit into a certain pair of jeans, and if they gain muscle, people, it's almost like you do get these practitioners who are like, yeah, but you want big legs, big legs are sexy. That's fine if that's your opinion, But it's down to the individual what they want to look like or do or gain or not gain. It's super important. Beauty is in the eye of the beholder, and we can all choose how we want to look, give or take, or we can all have ideals of what we'd like, or that we might want to work towards or not work towards. So that's bearing that in mind with regards to creatine and the increase in intracellular water, is that it might make clothing feel a little bit tighter if you've got good muscle mass in your legs and it increases your creatine stores and water there. So you might feel like, oh, I'm getting fatter because your measurement of fatter is the tightness of your jeans. It's worth bearing that in mind. And I feel like I should say this, but I don't feel like I should have to. But it's nice to say it, that there's no judgment on my part, or there shouldn't really be any judgment on anyone's part if that makes you feel better or worse about yourself, if they're tighter or not. My wish for you would be that it didn't affect your happiness or your feelings of attractiveness, or your feelings of worth or anything like that. But I do understand that is the case for some people, so I don't want to just not discuss it. So I hope that's helpful, and I hope I've been clear. Right, so any of these other questions around puffiness, does it last the entire course of supplementing? Yes. It's different for different people. Cool, so I feel like I've answered a lot of those questions. I actually just suddenly thought someone said something on... I'll just say this quickly. I'll probably say this in my how to use it dosing podcast as well, but just bearing in mind that you're increasing the amount of water in your body. And so one of the other questions I'm going to answer here is about muscle cramps, headaches, dehydration, that kind of stuff. And I suppose I'll just cover the headaches thing really, really quickly here, in that in the time period of loading, whether that's 7 days or 30 days, depending on how you do it and how long it takes your body to saturate the levels, you will be pulling water into the muscle from elsewhere in the body. Now, you'll obviously be consuming some water through food and drink, teas and coffees, water, juices, fruits, carbohydrates, all these areas you get water from, and all your different foods and drinks, and you can use those. I've seen people say, drinking tea, it doesn't count, like your body magically. I've actually seen that. I'm a big sugar-free squash drinker. I don't like the taste of water particularly. And I've seen some of these gurus on the internet being like, your body it rejects when you drink squash and cordials, your body rejects the water because it's, I don't know what they make up, like it's somehow bound to the squash and it's in this form that your body can't use. It's just crazy, isn't it? When you say stuff like that out loud, you just think, my goodness, these people exist. It sounds less stupid when they say it, but when I'm saying it back to explain what they're saying, I'm like, wow. So my thing to say here is, when you are loading, yes, you might actually need to increase your water intake a little. It's not dramatic. People go, you need to drink an extra litre of water a day. That isn't true. To put it in perspective, if you were needing to drink an extra litre of water a day with your creatine supplementation and you loaded for 7 days, and past that point, you're kind of at homeostasis, you're in a balance, you're not needing more water than you are anymore. But if you needed this extra litre or 500 mils, that would essentially be assuming or making out that you are going to gain 7 kilograms when supplementing with creatine, which is fairly unheard of as far as I know. If anyone's telling you they've gained 7 kilograms supplementing with creatine, they're probably taking a very different type of creatine, creatine enanthate. So, in joke, don't worry about that one, just forget it. So, yeah, you probably do need to increase your water intake a little bit. Now, people who have good drinking habits will often drink a little bit more than they need. Their urine will be very clear. I've talked about this before, like keep your urine relatively clear throughout the day, and that's one of your best measures of are you keeping up with hydration. And therefore, the extra water that your body's taking from your fluid intake might not affect you at all. If you're someone like me who's not very good with fluid intake, you might just need to pay a little bit more attention. Otherwise, you may end up with a headache. Cool. I'll leave it there. Right. So I've got these questions in a different order. So I'm just actually going to talk about dehydration because we're kind of on that topic. So a lot of people put on the posts, and actually a couple in my the suggestion form on the website, about, does creatine give you muscle cramps? And it's quite an interesting one. This is one of those myths that has been around for years and years and years and years. Ever since I probably first learned about creatine like 20 years ago, it was one of the big myths. And so because it was a big myth, the researchers kind of went out and did the studies. And I've actually found quite an interesting study which I just was never aware of. It's very, very niche, in some nephrology journal. Really interestingly. So because essentially what we're saying is creatine actually hydrates your body. Your total body water increases when you supplement with creatine. So you're more hydrated. And so, as I've said, during that very short period of time of loading, maybe water, you need more water. Therefore, you could talk about this differential between need and what you're giving your body. You may need more, and if you're not supplying it, then you could say you've got this deficit of hydration. So you're calling it like dehydration, even though your body has actually got more water in it. But ignoring that, by supplementing with creatine, you are giving your body more water, more access to water. So interestingly, based on that, and there's two things I'll talk about here because so injury, some people go, will I get more injured? And I mentioned in the last podcast in terms of performance, injury is another area where I think, did I make a note of anything here? No. In terms of, I'll maybe link you to an injury study just so you can see. But essentially, they have tested it in athletes and cramping and injury, and does it increase the incidence? And it just doesn't seem to. But the study that I did make a note of, because I actually asked Toby to go and find it for me, because it was one of the studies when I was studying at university that was discussed, and it was about anterior compartment pressure in the lower leg. And so essentially you've got this thing called compartment syndrome. So it's Pottega et al. 2001. And something that people might call cramp or might think is some sort of injury. But essentially, because we do get this increase in skeletal muscle mass, this increase in cellular volume, there might be this increase in pressure because your tibialis anterior, and where it sits, so it's a muscle kind of in the front of your shin, where it sits with your tibia and fibia, which are the bones in your leg, there might be an increase in pressure there, which then just kind of, again, gives this painful, burning, crampy sort of sensation. And that was one of the early discussions around, does creatine cause injury or is it causing muscle cramps? But it's been tested in athletes, and time again, even actually showing a reduction in the incidence of cramping with creatine supplementation, which kind of makes sense because you've got more availability of water. So they've done studies in, I think, like American footballers, college footballers. You always see in the title of these studies, and therefore. And they're showing that with typical dosing strategies that might be used by these athletes, but actually doing the study and doing the controls, showing a decrease in the incidence, a significant decrease in the instance of muscle cramping. So yeah, so with regards to that whole discussion, it's not really a thing. I'm just having a quick look at these questions. Does creatine give you muscle cramps? Possibility of compartment syndrome. Will creatine give me headaches? Okay, so those were the main questions around this. So I will try and segue into the final quick discussion around kidney health. Kidney health, again, kidneys being an area in the body that help with the processing of water. But this study, which was looking at muscle cramps in dialysis patients, these patients were fairly end-stage renal disease, so kidney disease. They had very unhealthy kidneys. And I was super, super surprised. Well, one thing to say about this study, it was out of a hospital in Taiwan, and it clearly had, I'm not comfortable with it for a number of reasons, not least of all that they can't get their units right in the study. And this is supposed to be a peer-reviewed study. So when you read the study, they keep talking about 12 milligrams of creatine, which I was like, what a bonkers amount of creatine. And then I thought, well, it is in these patients, hemodialysis patients. I thought, well, maybe they're being very, very careful because creatine is something that, and I know lots of my listeners have kidney disease because of all the questions that have come on the suggestion form. And there was actually a discussion about kidney disease in the mentoring lab recently. So it's just a topic that comes up time and time again. So I just want to give a decent account of this. So lots of consultants will say, definitely stay away from creatine. And I also want to just say, I'm not encouraging anyone with kidney disease to take creatine, but what I am going to do is I will post at least 3 study links within the show notes, same as usual, martin-mcdonald.com/EP, and then whatever episode this is. I don't actually know. I should really keep up with what episodes we're on. And you can get these studies, because I would like to empower you with those so that you can take them to discuss them with a consultant. There is also this discussion of like, why do you need to take creatine? But I really want to be jacked. I really want this, that, and the other. And that's completely up to you. But it's also sometimes, not eating boatloads of protein is something that is advised for individuals with kidney disease. And people often kind of try to push the boundaries. But I really want this. How much can I have? What's the maximum I can have? And sometimes I just want to have the discussion with them of like life choices. What's really important to them? Staying away from needing dialysis, needing a kidney transplant for as long as possible, or having slightly bigger biceps. And as coaches and practitioners listening, would be something good for you guys to have a discussion with these individuals. And it's obviously personal choice. I'm all about personal choice. But just that informed discussion is important. So anyway, this study, annoyingly, they used 12 grams. I ended up getting the full paper, reading the full paper. They actually used 12 grams of creatine. I think they diluted it in about 100 mils of water. And they drank the whole 100 mils 5 minutes before they underwent dialysis. And what they were looking at, the reason they were doing this, the reason they were studying it, was to see if they could reduce the incidence of cramping in individuals undergoing dialysis. And they found significant benefits. They measured creatinine, the waste byproduct of creatine, or it goes up as a result of consuming creatine. And there was a significant increase. It wasn't huge. I just found it very interesting again in this instance of they were obviously happy to do this. Now I'm not an expert in this area, I will say that. And unfortunately, some of the experts and supposed experts in this area also aren't experts. So I'm always very, very disappointed when people come into the lab, the mentoring lab, and have been referred to renal dietitians. And their questions haven't been able to be answered. They've had phone calls, they've been referred by their consultant, and they've told them nothing. They've not explained anything to them. But not just they have left it out, they've been asked specific questions and they do not know the answer. Like, if that's your job, you're in charge of someone's health, I just find it unethical, negligent that these people can live with themselves not being able to answer these questions. Like, there'll always be an answer, but some of the questions that these dietitians, renal dietitians, haven't been able to answer to these patients, and then they end up in the lab asking. And I have an issue with talking about this stuff on the internet because I'm not an expert in this area and I'm not their healthcare practitioner. And it's not for me to be, but so I just try and signpost them to studies to then go back and discuss, the pros and cons of a vegetarian versus a meat diet and the, excretion, nitrogen waste products as a result of eating different things. Anyway, I'm going off on one. It's just annoying. So that's why I'm just discussing this. This study very, very interestingly found this significant decrease in cramping with 12 grams, per treatment, which is it's just quite a large dose. Anyway, I'll just touch on healthy individuals as well. There's no evidence that creatine is causing kidney issues in otherwise healthy individuals, even to the extent of if you have one kidney, but it is fully functioning and it's you've got no issues. Seemingly, again, I had an athlete that I worked with over a couple of Paralympic Games, and he had spina bifida. He only had one kidney, and with myself and the medical team that was supporting him, there was seen no reason why he couldn't use creatine, and he used it for probably a period of about 6 years that I was working with him, roughly. And then things never got worse from using it. So it's an N=1 anecdote, but seemingly based on all the other research, there's just, some people say, is it okay use long term? Like, people have been using creatine now for 30 plus years. We are probably far enough down the road to start seeing if there was some boogeyman that's going to come out and, oh no, crap, look what we've done to these people. And you would also need a mechanism. You would also need something to be seemingly changing in a deleterious manner. Good word, isn't it? To even suggest that. You can't link clinical situations that are already an issue and then go, this is going to happen to otherwise healthy individuals. That's not how it works. Cool. So one thing I will say actually is that seemingly with the studies in this area, going back to renal disease, is that often something called homocysteine is measured, and an increase in homocysteine seems to be linked to cardiovascular events, negative cardiovascular events. And in the studies, homocysteine sometimes increases with creatine supplementation. But again, it's this blanket, take 5 grams. And 5 grams really for a lot of body sizes is a loading dose of creatine. So if you take 5 grams indefinitely, you're kind of loading indefinitely, as opposed to using a relative dose to your body weight, which I'll talk about in the dosing episode. And whereas in other studies, which again have used absolute levels, and I'll link to these papers, but using 5 grams in people with kidney disease versus 2 grams in individuals with kidney disease, the 2 gram situation isn't worsening anything, but 5 grams was slightly elevating homocysteine. So maybe there's this argument of, and the reason being is like someone might want to supplement with a small amount because maybe it helps with cramping, as we've mentioned there, or there might be other things that it could be benefiting. Some interesting stuff on gut health, and all the stuff I've talked about with regards to brain and recovery from exercise and all this jazz. There you go. So that got a bit technical at the end there. And one other thing is type 2 diabetes. I've seen people recommending against it for individuals with type 2 diabetes. And again, I don't think that is a fair recommendation or thing to do. Because type 2 diabetes does not automatically mean kidney issues. So again, if someone has there's something called GFR, estimated GFR, that gets measured. And if there's nothing suggesting, it's just one of numerous different methods that can be used. Creatinine being another one that is often measured. So I think I mentioned this elsewhere, but if you have an elevated creatinine level that gets measured sometime and you're taking creatine, do inform whoever's done the measurement that you are taking creatine, because it will artificially elevate that level. And so maybe you can stop the creatine and then see if it goes back to normal, and therefore it's not showing an issue with your kidneys. It's just showing that you're supplementing with creatine. And it's very normal to be getting rid of more creatinine because of that. But in type 2 diabetics, there are studies that have used creatine in type 2 diabetics with no negative effects. And, I don't think you'll find one that shows negative effects unless that individual has got, secondary issues with their kidney as well. Cool. I just remembered that I wanted to. And I'll link you to some a study or two on that as well. Cool. Not as quick as I'd hoped, but hope you enjoyed it. Next episode, I will talk about some of your other questions, one of which is hair loss. So many questions on hair loss. A bit of an expert on hair loss, me. What else? Acne, pregnancy, breastfeeding, stuff like that. Cool. Till next time, much love.